Osteoporosis. A comprehensive overview of symptoms, risks, and management. Osteoporosis is a progressive bone disease characterized by decreased bone density and increased fracture risk. Affecting an estimated 200 million people worldwide, primarily postmenopausal women, it often remains undetected until a fracture occurs. While there's no cure, understanding the condition and adopting preventative measures can significantly slow its progression and protect bone health. Understanding bone loss. A natural process gone awry throughout life, bone undergoes constant remodeling. A cycle of breakdown, resorption, and rebuilding formation. During childhood and adolescence, formation outpaces resorption, leading to growth. Peak bone density is typically reached around age 30. After this point, resorption gradually exceeds formation, leading to a natural decline in bone mass. Osteoporosis develops when this balance is disrupted, with excessive bone breakdown or insufficient bone formation. This weakening makes bones brittle and susceptible to fractures, even from minor falls or everyday activities. Recognizing the silent threat. Symptoms and risk factors in its early stages, osteoporosis often presents no obvious symptoms. Many individuals remain unaware of their condition until a fracture occurs, frequently in the spine, wrist, or hip. As the disease progresses, subtle signs may emerge. Back pain, often due to vertebral compression fractures. Height loss, gradual shrinking due to spinal collapse. Stooped posture, a visible sign of weakening spinal bones. Increased fracture risk, bones break more easily, even with minimal trauma. Several factors increase osteoporosis risk. Gender and age. Women, especially postmenopausal, are at higher risk due to estrogen decline. The risk also rises sharply after age 50 for both sexes. Genetics. A family history of fractures increases susceptibility. Lifestyle. Smoking, excessive alcohol consumption, lack of exercise, and poor diet, low in calcium and vitamin D, accelerate bone loss. Medical conditions. Certain illnesses and medications, like glucocorticoids, can contribute to bone weakening. Diagnosis. Measuring bone density. Diagnosing osteoporosis involves assessing risk factors and performing a bone mineral density (BMD) test. The most common method is the DXA, dual energy X-ray absorptiometry scan, a painless procedure using low-dose radiation. Results are reported as T-scores, comparing an individual's BMD to that of healthy young adults. Normal, T-score of -1 or higher. Osteopenia, low bone density, T-score between -1.1 and -2.4. Osteoporosis, T-score of -2.5 or lower. The FRAX tool estimates fracture probability over 10 years, helping guide treatment decisions. Fragility. Fractures, breaks from low-impact falls, can also indicate underlying osteoporosis. Prevention and management. Strengthening bones for life. While osteoporosis cannot be cured, its progression can be slowed through lifestyle changes and medical interventions. Early bone building. Maximize bone mass during childhood and adolescence through calcium-rich diets and weight-bearing exercise. Healthy habits. Avoid smoking, limit alcohol intake, and maintain a balanced diet rich in calcium and vitamin D. Weight-bearing exercise. Activities like walking, hiking, and strength training stimulate bone formation. Medical treatment. Medications such as bisphosphonates, denosumab, or anabolic agents can slow bone loss or promote new bone growth. The long-term outlook. Osteoporosis is a chronic condition requiring lifelong management. Consistent treatment, including exercise, nutrition, and potentially medication, can help maintain bone strength and reduce fracture risk. However, it's crucial to remember that once osteoporosis develops, restoring peak bone density is unlikely. The key takeaway: proactive prevention and early intervention are critical for minimizing the impact of this widespread bone disease.